Hello, everyone. My name is Dr. Mitchell Kim. I'm a general dentist, and as far as my passion for providing modern care, modern dental care, I think it's important that we incorporate, the latest technologies, not only to be more efficient with the appointment, but also to kind of showcase, what's possible in dentistry today. We utilize digital cameras, digital X-rays and digital scanners to kind of help bring a comprehensive picture of where patients, current, oral, status is, whether it be they're focusing on their alignment of teeth, the general state of, whether or not there may be some issues with their gum health or cavities. Having visuals, speaks, volumes as far as being able to see where you're currently at. And so I think it's really important that we're able to incorporate those pieces of technology to kind of help people see what we're seeing. Sometimes, describing something verbally may not provide a clear picture and may bring forth more questions than answers. And so that's why I think, having, a lot of pieces of technology will kind of help clear things up, make sure that, I'm on the same page with the patient and they feel a little bit more comfortable being able to see what I'm seeing and that, they feel, they're able to see where they're at themselves. As far as their first visit, I think every practice might provide a different experience. At my office, some of the things that they may not be accustomed to would probably be having a digital scan of their mouth completed with our intraoral scanner. That provides a computerized model for them to be able to see their teeth in their jaw spatially. We can rotate it, zoom in and out. They can kind of see the alignment of where their teeth are currently, in addition to any specific areas. Maybe they can tell that something is chipped or fractured, but they can't really see it, especially if it's one of their upper teeth, and they're not able to visualize it in the mirror themselves. Another piece of equipment that we offer for our comprehensive new patient exams would be using a 3D X-ray, which we call a CBCT, and that provides us the ability to see a more comprehensive view of their jaw along with their teeth and their airway, kind of their sinuses in their nose, and helps us kind of see things that traditional 2D X-rays may not provide us. It gives us more in-depth information that can help us pinpoint specific problems that they may have had issues with and not gotten resolution through different treatment options that were provided or procedures that were done in the past. And so, we like to think that there are some things that we can provide the patient that maybe they didn't have access to at their other offices that they were seeing before. It's important because the sooner we can pinpoint a specific problem, maybe it's an easier solution to deal with rather than letting it, kind of linger on. The longer a problem exists, the worse it can get, and the more drastic treatment options may be necessary. We may need to incorporate different specialists, if we're not able to kind of deal with the problem at an early state. And so, being more of a proactive practice and trying to take care of preventive care at the forefront will kind of help limit, things that we may need to talk about in the future if they weren't able to address them, relatively soon. Obviously, it's up to the patient, depending on, where they are with their kind of their personal health. If they need some time to get to where they need to be to complete the treatment, we totally understand. But it's always an option that we like to give, and putting patients, position at the front where they're in control of deciding what they would like to do. That's kind of our job, is to make sure that they know what their options are, and then kind of helping them see which would be the easier way to go versus making it a little bit more difficult than it need to be. It's really just providing information for them. And really, the comprehensive exam starts off by kind of going over what is their main goal for their visit with us, because we can't assume that every person that we meet as a new patient for the practice has the same, motivation for wanting to schedule the appointment. So we kind of like to go over what it is that they're thinking. Are they having specific problems? Are they just trying to find a new practice to join if they just moved to the area because of work or something like that? Or do they have like an actual long-term goal that they've been trying to work towards, but they haven't found a good fit maybe at another practice? A lot of general questions will lead us to, kind of pinpointing exactly what it is we'd like to talk about. if we need to go over steps on how to get there, if we need visual aids. Like I said, we have digital scanners that we can use to create models for your teeth, 3D x-rays, intraoral cameras to kind of take photographs of specific areas that may be difficult to visually access the patient themselves. Using all those visual tools, we can kind of have a comprehensive discussion about where it is that they want to direct their care. And then, our job is to help with that. So, and then it really helps make the discussion more productive, being on the same page and seeing the same things. Some of the things that are overlooked are the importance of their frequency. I think when people come at their scheduled intervals, they may kind of start to wonder, why is it that they're having to do that if they're not having any problems. And we try to reinforce that the reason that they aren't having any problems is that they've been staying on top of their scheduled visits and not letting it lapse to where 6 months turns into a year, turns into a few years, and then things can come up in that time frame. So I think it's important for us to kind of re-emphasize that being able to see them every 3 to 6 months, depending on what frequency we recommend for their visits, kind of helps keeps things, in a good state. And if we can catch something super early, our intervention would be minimal. And so I think that's kind of lost on some people if they've been doing it for such a long time that they're not sure why they're having to come so frequently, if they're not having any issues. And we kind of want to emphasize that, that's why they don't have any issues. It's because they're able to stay on track and make sure they maintain their checkup visits with us. We tailor our plans based on the patient because some people have specific issues that may take longer to resolve. Their comfort level is one. Some people's tolerance for getting dental work may be more or less than another person's. Fatigue is a big issue. I understand that having to lean back in a chair for a certain period of time, keeping your mouth open, people's ability to do that may vary. Some people can do it for much longer than others. Anxiety is a big issue, so we have to kind of incorporate different ways to focus on how to get them to be a little bit more comfortable and less anxious about getting dental work done, especially if it's a new time or first time patient with us where they may have not experienced how our appointments are kind of structured. I think comfort comes with frequency and having multiple visits under their belt. I think they get a little bit more comfortable, and so we can kind of design time frame wise where they would like to be, in length of appointment, what time of day, if they need to space it out, just because they have other things going on in their life. We really try to focus on what's going on with them, to kind of help them get to where they want to be. But obviously, if they have an end goal, maybe it's a big special event. Maybe it's a wedding or an anniversary or something like that. We always kind of put that in the forefront and then kind of figure out how many visits we'll take and, go from there. But really, it's kind of up to them. They kind of tell us how much they can do, before a certain time, how often they would like to come see us. So it's not set in stone what we need to do and how much time, but it's really up to the patient. We kind of work with them on that. If you want to experience a more comprehensive first dental visit, please call our office. We can definitely set up an appointment, whether if you just want to talk to me about specific issues or you want to talk to me and meet my hygienist as well. We have different ways to set up a first appointment for every patient. So give us a call. We can definitely talk you through it. It's not, a concrete first visit that we schedule for everybody. We can kind of tailor the appointment depending on what it is that you're looking to get done or want to get accomplished.